Welcome
morning. Unmute my microphone.
Well, we're all doing something different this time, so we'll get going here and hopefully do it well. Good morning, everyone. Welcome to meeting number 1 of the House Budget Review Subcommittee on Economic Development, Environmental and Public Protection, et cetera, et cetera. Due to continuing issues related to COVID-19, we obviously have some new meeting protocols in place for the interim. For those of you who are legislators, I'm sure you're aware that remote access will be allowed to all meetings for the interim. Members have been provided information prior to the meeting on how to access the meeting remotely, and the meeting materials were in fact put online earlier this week and may have made available for downloading. At this time, I'll have the secretary call the roll. Members, you will need to indicate whether you are present in person, remote from your district, or remote from your office. Madam Secretary.
Senator Clark, Senator Kerr, Senator McGarvey, Senator Wise, Representative Branham Clark, present. Representative Hale, here. Representative Maddox, here. Representative Palumbo, Representative Rowland, Representative Shamor, Representative Yates,
here.
Senator Humphreys, Senator McDaniel,
Here in person.
Representative Reed, here. Representative Rudy, Representative Weber, here. Senator Girdler, Chair Beckley.
Here in person. First off, I want to apologize. I said Madam Secretary. Got in a habit for whatever reason. I should not have, Mr. Secretary. Can you tell me, do we have enough for a quorum? All right, we do have a quorum. Okay. Representative Shamor, I understand you have a guest.
Thank you, Mr. Chairman. Yes, I'd like to welcome Kim Luna, who is from Radcliffe, Kentucky. She's a guest today, and make her feel welcome. Thank you.
Okay, let's get going here. This morning we're going to hear from several people. We're going to start off with Secretary Noble. And Madam Secretary, would you please identify yourself for the record? And I would ask members to hold their questions until after the Secretary's presentation.
Good morning, everyone. I am Mary Noble, Secretary of Justice and Public Safety Cabinet. I have with me today Commissioner Cookie Cruz, who is the Commissioner of the Department of Corrections. This is all of the 3rd day of her being at work on the job. And so she's getting her trial by fire, folks, appearing in front of you today. I have with me also the Commissioner of the State Police, Commissioner Rodney Brewer. Thank you, first of all, for giving our cabinet the opportunity to come and talk to you about the things that we've been doing as part of our COVID-19 response. I was telling someone the other day that in all of 71 years, this has been the strangest, scariest, most devastating experience that I have ever seen, and in witnessing the effects of it, not only on the elderly, but some of the middle-aged. And now we find that there is a very scary effect on our children, sometimes 3 or 4 weeks after they have contacted the virus. You sent us some questions that you wanted us to answer. I'm going to answer one of them. Commissioner Cruz will answer one, and Commissioner Brewer will answer one. I wanted to give you, first of all, a little bit of an overview of our cabinet. The Cabinet of Justice and Public Safety is composed of an administrative office of the Secretary and 5 departments. They're somewhat diverse. We have the Department of Corrections and the Department of Juvenile Justice. We have the Kentucky State Police and the Department of Criminal Justice Training, and we have the Department of Public Advocacy. All of those departments, as you might imagine, deal with a lot of people. For example, the Department of Corrections has the lives of roughly 12,000 prisoners in their hands, scattered throughout the 13 correctional institutions that we have in this state. And in addition, another 12,000 or so, these are approximate numbers, that are housed in the county jails because they have Class D felonies or Class C5 felonies. The Department of Criminal Justice Training is responsible for the training for all local law enforcement and conducts an academy to do this. Our contact with people and our responsibility for contact with people is large. There are roughly 7,000 employees in our cabinet, and we work with a budget of over $1 billion. Everything we do has a deal of complication to it, a lot of record keeping, a lot of supporting documents, because it gets back to the lives and the work of a lot of people. You've asked us to comment to you today about the expenses related to COVID-19 activity, about the commutations that Governor Beshear issued in regards to COVID-19, and the enforcement efforts related to COVID-19 orders from the governor. I'm going to speak to you first about the expenses. And let me lead off by saying about that it is absolutely my intention, because it is Governor Beshear's intention, that we and all the cabinets be very transparent with the legislature. If you ask us for information, we're going to do our best to try to get it to you. I want to explain to you why I did not provide you today with a listing of expenses. I think we owe, as a matter of respect to this committee, to explain where we are and why I don't have them today. When this novel coronavirus, and it's a new thing, that's why they call it novel, hit us, nobody knew what it was going to require, what we were going to have to do. We did not know because no one else knew. And to some extent, it's been a steep and huge learning curve. When we began this process, whenever we had to do something that was related to the coronavirus situation, we thought at first that it was business as usual. And so any expense that we had would be part of our ordinary expensing business. As time went on and as demands got greater, we had more things that we had to do that were out of the ordinary. It involved a great many more man being devoted to efforts for the coronavirus. For example, I know everybody is aware that we have these 13 institutions in our state, and that one of them, the Green River Complex, did in fact have an infection. What we tried so hard to do were two things: prevention, and then if we could not prevent it from occurring, containment. I can say to you today, and I'm careful to say it because with this insidious virus, things could change overnight. We all know that. But as of today, 12 of our 13 institutions have not had an outbreak because of the effort that we started, that we began almost immediately by ceasing visitation and people going into the institutions, extensive sanitization, and just simply some retraining for our correctional officers, the wearing of PPE, and actually giving a PPE to the inmates. This was incredibly important that we all work together to contain this. As we went on, we simply bought, purchased, used the things that we needed to accomplish this. Thinking it was, if not the ordinary course of business, because this is what you do. You take care of the needs that arise as they arise. So we did not do special coding or anything of that nature for our expenses. Then the state of Kentucky was granted a part of the CARES award, and we are now able to seek reimbursement through the CARES funding for expenses. We are currently compiling those costs of responding to COVID-19. The particular costs that are being considered are those that would be eligible for reimbursement. And I do not have to tell any of you in this hard budget situation in which we find ourselves, in this hard financial situation today, that if we are able to obtain reimbursement for any of our expenses, this could be critical into how we continue our operations. So we are able to seek reimbursement for things such as the portion of an employee's workload that was devoted to coronavirus, and for expenses of things. For example, the cost of the PPE. I'll give you another example. We order sanitization trays that we put outside the institution so that staff and correctional officers coming in walk through it. It sanitizes their shoes. This is not something we had before that we had a serious need for before, but we have purchased those for each of the institutions now. There are expenses that are ongoing, keeping the mask, the PPE up, and there will be additional medical costs that we will have to consider for the treatment of those that contracted this disease. So that's the types of things that we're spending it on, but here is the problem. We now need to recode this material in a way that it can be pulled out and selected for application for reimbursement to the coronavirus fund. And I will tell you that we have been working on that. And I told you about our numbers purposefully so that you could understand that I am respectfully saying to you today, I don't have those numbers today, but we are in the process of acquiring them. We'll have to look at the employment records of everybody that's done something that's coronavirus related. It is I don't speak budget. Those of you who've dealt with a budget before, you know, when you talk to your budget director, they're going to use codes like EMARS and 203J2, and it's like a foreign language to me. But I understand what they're talking about when they talk about funding streams and how you have to be very careful to separate out the appropriate cost, so that what we're paying for from general fund should come from that, what we're paying for from a restricted fund should come from that, and what we are paying for that can be reimbursed by the coronavirus relief fund, we make sure that we get it. So we've been working on that for about going on 3 weeks now. It is in progress. It is not a secret. I'll be glad to share it with you as soon as it's completed. But certainly, I was not able to give it to you piecemeal because, for one thing, that would be meaningless. And you could ask me, you could say, Justice Noble or Secretary Noble, why didn't you give us an estimate on this? And I would say, I'm not into fiction. I don't want to be telling you something that is not supportable and that we can't give you accurate information about. I won't lie to you. There's been a lot of days when I felt like the frog that fell in the milk bucket. And all you can do is kick hard enough to make a mound of butter that you can sit on and catch your breath. That's the way it's been for some of the things that we've done. But we're working very hard in an ongoing effort to do what we need to do, and we are shepherding what we have spent the best that we can, and we'll compile that information and make it available as soon as it's in a cognizable form, Mr. Chairman. And so I apologize to you for not having it today, but I certainly felt I owed you in this committee the respect of explaining why, and that we would. Now, I have asked Commissioner Cruz if she will direct or will speak to you about the commutations, and we're here at the Justice Cabinet in Frankfurt in our hearing room, and we are maintaining social distance. So I'm going to put on my mask and let her come up to the chair. It may be that I add some information, if necessary, what Commissioner Cruz has to say. Remember, 3 days on the job, so she's going to give you the best information that she can gather at this point in time. Thank you.
Thank you.
Questions now, or do you want to wait till the end?
We'll wait till the end.
Commissioner Cruz.
Good morning.
Good morning. Thank you for coming to testify, and please introduce yourself for the record.
My name is Cookie Cruz. I'm the Commissioner of the Department of Corrections.
Thank you.
In order to safely decrease the overpopulated prisons and jails of the Commonwealth, the governor has conditionally commutated the sentence of 1,235 inmates. This action both helped to protect those inmates who are most vulnerable to COVID-19 while allowing prisons and jails to be able to keep their correction staff safe from COVID-19. To date, Governor Beshear has conditionally commuted the sentence of offenders in 3 groups. Prison inmates who were deemed by medical professionals at a higher risk for severe illness or death due to their medical condition or age, per the CDC guidelines, who has had less than 5 years of their sentence left to serve. Jail inmates who were deemed by medical professionals in a higher risk for severe illness or death due to their medical condition or age, per CDC guidelines, who had less than 5 years of their sentence left to serve. Offenders in jails and prisons who were within 6 months of serving out their sentence. All of these inmates were serving sentences for nonviolent, non-sexual offense to ensure public safety was taken into account. Specifically, the following crimes were excluded from consideration by the governor. All crimes violated by statute, all crimes violated by ASCA definition of violent or other violent except for wanton endangerment, all sex crimes regardless of crime type, all sentence of life or life without parole. These crimes, arson, sex, any crime with the word sex in the title, manslaughter, homicide, stalking, assault, robbery, and any crime with the word immoral or abuse. Below is a list of specific CDC recommended prior medical conditions that was used to identify these inmates and classify them as vulnerable and eligible for early release. Heart disease, lung, that includes severe asthma, COPD, chronic bronchitis, and emphysema, diabetes, liver failure, kidney failure, cancer, receiving chemo or radiation, HIV, and 65 and over. Each of these inmates receive a conditional commutation. That means they had to sign a form agreeing that they must meet the following qualifications: had a verifiable home placement, were not experienced COVID-19 symptoms, and had not been tested positive for COVID-19 symptoms. If they could not meet these qualifications, they were not released until they could. Some could not meet these qualifications at all and have not been released. They also had to sign a form agreeing to abide by the following restrictions: to self-quarantine in their verified home placement for 14 days to ensure that they did not have COVID-19, and to not commit any additional crimes during their period of release. One of these individuals violated this term, his or her commutation could be revoked, and then he or she would have to serve out the remainder of their sentence. So,
Do y'all want to question now, or can we proceed with our other part of the presentation?
I'm sorry, I didn't hear that.
she said, do you want to ask questions now, or you want to wait until Commissioner Brewer does his?
I'll after Commissioner Brewer, and you'll
There you
probably
go.
all have to put your mask back on and come to the table.
Yeah. Thank you.
Mr. Chairman and committee, it's good to be with you today. Thanks for giving us a few minutes.
Thank
For
you.
the record, I'm Commissioner Rodney Brewer of the Kentucky State Police.
Thank you. Please proceed.
Yes, sir. There were several questions about things that the state police have been involved in that took us outside the scope of our normal mission and job duties. And I've kind of got those boiled down in about 4 or 5 different categories that I'll briefly discuss with you today. The first one is obviously our involvement in the Emergency Operations Center over at the Boone National Guard. We have logged over 1,000 hours at the command center interacting with our partners at the local, state, and federal level since the COVID-19 crisis began. Through that, we've done a lot of planning, a lot of interaction with those folks. The second piece is that part of that has been setting up and planning and actually implementing the COVID-19 testing sites. We have currently put up 21 sites, 17 of those actual sites, and 4 were repeat. So we've been involved in 21 different testing sites located geographically throughout the state. The third function is what we call the hospital security detail, and we were asked to provide extra security at hospitals outside of the Louisville and Lexington area throughout rural Kentucky to provide a presence there in the emergency room in the event that the hospitals reach capacity, and to make sure that order is maintained and calm throughout this crisis. Over a 30-day period, we provided security with some help from local agencies at 90 hospitals throughout the rural area of Kentucky outside of Jefferson and Fayette County. The hospitals in Jefferson and Fayette County were handled by Louisville Metro and Lexington Metro Police Department, respectively. At the post level, we shifted our focus and identified what we felt were high-profile retail establishments that needed extra patrol, particularly in the early days of the COVID-19 pandemic. These included grocery stores, retail outlets, and so forth. This was a visual deterrent regarding any theft that might take place, and also to monitor social distancing and to make sure that people were calm and well behaved in those environments. We identified about 839 retail establishments throughout the state that we targeted for extra patrol. And during that 30-day period, our troopers visited either by vehicle or sometimes in person 6,173 locations. This does not include extra patrol that we put out there. Get some mic feedback. This does not include extra patrol at schools. Since the schools were closed down, we felt like they needed some extra patrol as well to prevent from any vandalism or break-ins, and also churches and some other establishments. After those site visits, on the list is additional security on the Capitol grounds. Since the 1st of April, we've had a pretty strong presence at the Capitol and the Capitol Annex and the mansion. To date, we've had extra patrols there, particularly on the days where we had organized protests, which we've had 6 or 7 organized protests since this began. But since about the 1st of April, we've had an extra presence at the Capitol, and we have been maintaining that throughout the COVID process. Kind of stop right there. Those are the general categories. The last one, I believe that was one of the questions, was site-based, faith-based visits. During Easter week, as many of you know, we had several religious organizations that we followed up on to make sure that they were social distancing. We got about 51 complaints that we responded to. Many of those were by telephone. They were not in person. Calling local leaders and discussing social distancing guidelines and things with them. That was throughout the state, but it was basically centered in 3 or 4 post areas, mostly to the west. We had a few in eastern Kentucky as well. So I'll kind of stop right there. It's been some challenges for us, obviously, like everyone else. Our workforce, for instance, our driver testing folks, there hasn't been much for them to do when we initially closed down our driver testing stations and the clerk's office is closed. But we managed to take those 50 individuals that normally give driver's tests, and to their credit, they shifted their energies into a fingerprint backlog that we've had for several years. We've had over 1 million paper fingerprint cards that needed to be scanned and proofed and put into our automated fingerprint information system. And to date, due to their efforts, we've cut into that backlog by over 400,000 fingerprint cards. So they've done a great job. We split the shifts at our crime labs. We also quit taking evidence for about 30 days, except by U.S. mail. We're still on staggered shifts, but we're taking evidence from different police agencies by appointment. And our records section, which houses quite a few folks over on Louisville Road, we've split them in split shifts as well so that they can social distance and separate while they continue to provide those services for the Commonwealth. So I'll stop right there and answer any questions that I can from the committee, or I'll turn it back over to Secretary Noble.
Commissioner, why don't you stay there kind of real close, and Secretary Noble and Commissioner Cruz, will you kind of come up too, because we have some questions that I suspect are for all of you.
Yes, sir.
Why don't you stay there? And Darren, if it's all right with you, we'll just leave our mask on and we'll move up here. Are we moving into your picture frame?
That'd be fine. Wear your mask and get there. That would be great.
Okay. Okay.
Okay, thank all three of you for your presentations. I certainly appreciate it. Madam Secretary, you mentioned that you will have an estimate or our costs at a later date, or what the COVID-19. I know that you're not going to give an estimate now, and I appreciate that, and I have no problem. Do you know, roughly speaking, when you might have those numbers for us?
I spoke with my budget director just last night about that because I wanted the most accurate information I can give you. And his indication to me is that they are really trying to figure out how to code it. This is a new experience for me. The budgeting that I had done with the court system was a lot simpler, it seems, than what it is in the executive branch, because there are so many entries that you have to make. And the budgeting system here goes through EMARC, which I say that like I know what I'm talking about. It's an accounting system that the state used that y'all are probably very aware of. And everything in it goes into coding. And what I understand that they're working on right now is how to get this properly coded, because you can't make a claim for federal government funds that you can't fully support. I think we all appreciate that. And so they're separating that out. And if I had to guess, and please believe this is just a guess, I'd say it's going to take at least another 2 or 3 weeks.
Okay.
It's at least that, sir. There's a huge amount of data pieces that you have to recover. And as I said, I don't know what these sanitation trays cost, but just to make something up for an example, say you buy an item that costs $49.95. If you buy 200 of those items, you've got to go back and find those items and justify how they were used for coke before you can properly make a claim. And all of our attention, all of my budget people's attention right now, and the office, budget director Hicks, the OBSD is focused on right now getting this, because I think we all understand financial forecast and the difficulty for financially. So
Okay, that'll be
to be
fine.
able.
Thank
Okay,
you.
sir.
You mentioned in your presentation that 12 of the 13 institutions haven't had the virus. Is that individuals, or is that, do you mean a large-scale breakout?
I mean an outbreak. What we have had is Green River. It's
Right.
like all enclosed populations. Once the virus gets in that enclosed population, the tragedy that we've seen in the nursing homes, the difficulty and hard work that we put in on Green River, once you get into a confined population, it's very difficult to contain. And that's potentially going into containment. To my knowledge, we've only had one other inmate at the other institutions that's positive, and there was no spread in that institution. We've had a small handful of correctional officers test positive, but they are immediately quarantined and not allowed back to work until they're clear. So we have been able, it's a miracle. It's a miracle. We have, God bless him, all I can say, we have been able to, so far, with our efforts, not to have an outbreak, sir, in those other prisons. And I just pray daily it continues that way.
Okay, thank you. We do have some questions. Senator McDaniel?
Thank you, Mr. Chairman. First, for Commissioner Cruz, Obviously, I think that the cost or the cost impact at the state institutions is going to be fairly minimal of these commutations because you still have your staff and your rotations you have to go through. But as it relates to the inmates that we house at county facilities, obviously there's a direct reduction in the amount of per diem we have to expend. Can you give us an idea of how many inmates we've pulled out of those county jails, and then what the cost savings has been there?
I don't have the information with me, but I can get that to you.
If you
And
could.
Senator Daniel, I can give you an estimate. I think there have been somewhere less than 6,000 people, somewhere in that neighborhood, released from the county jail, started to work county inmates. And so there actually has been something of a savings, I think, for county jails for those released from the inmates. We've had the releases of our people
Yes.
have been those that were part of the commutations for the felony offenders that are housed in the county jail.
Right, and that's actually what I'm looking for. Our $31 or so a day that we pay those county jails, you know, how much are we racking up in terms of savings from those commutations at this point?
Okay, sir, I don't think we have that number, but we can get it for you.
If you could, I'd appreciate it. That's
Yes,
great.
sir.
And then, Mr. Chair, I'd also like to talk to Commissioner Brewer just for a quick second there. Commissioner, clearly, when you were asked to come in here, the world for all of us was a much different place. February, we were in one space. By the middle of March, we were in another. And especially for your agency, you're in another right now. No question particular, but if you could just give us a comment as to the impacts currently of the protests and the riots and the security you're providing in Louisville.
Absolutely. We got requested by Mayor Fisher and then Chief Steve Conrad of the Louisville Metro Police Department early Friday morning to provide assistance with the approval of the governor. And we managed to mobilize forces pretty quickly. Since Friday evening, we have had between 90 and 100 troopers assist Louisville Metro and ultimately the National Guard that was brought in later to support their efforts to prevent violence and vandalism throughout the city. We have begun to rotate some of those troopers strictly from a fatigue factor. So we have sent some home, brought some of our crowd control squads in from other areas of the state. As a result of that, we've had to house some of them in Louisville. That expense is being picked up by Louisville Metro Police Department, as I understand it. And we have been down there since then. Usually our presence there is in the evening. Usually starts around 4 o'clock. That has varied a little bit depending upon the intelligence that they get. I will tell you that, and we're usually there until anywhere from 1 to 3 o'clock in the morning. Makes for some pretty long days, obviously. They have embraced our presence there. We've actually had very good interaction with some of the protesters as well. And as many of you know, there was a shooting that took the life of an individual at 26th and Broadway a couple of days ago, and we were asked to provide investigators and provide an independent oversight and assist in that investigation, and we have been doing that since that happened. That is our critical incident response team. These are some of the best investigators that we have in the Kentucky State Police. They serve a dual role. Their sole purpose is to investigate officer-involved shooting, ours, and a select few of other agencies as well on contract that we have, and also to reconstruct a very complex traffic crash. That's what these folks do. So they have been down there just about around the clock since that shooting occurred, and they have started to develop, obviously, some information that I believe has already been released to the public as well, and will continue to do that as those efforts go on. So I guess to answer your question, sir, I don't have a magic crystal ball. I'm not sure when this will end. That's everyone's question. It seems, gauging from last night, I was down there until the wee hours of the morning. It seems to have calmed down somewhat, and the protests seem to be much more peaceful than what they were last weekend. So we'll continue to monitor that, and per the governor's instructions, we're taking that day by day. Obviously, we want to continue to provide them any support that we can to help them and to keep the city safe. Most of our efforts have been in downtown Louisville. We have had some calls and provided some assistance out in the county in some of the retail establishments, but most of it has been centralized in downtown Louisville, near what I call the heart of the city, where the courthouse, police headquarters, and so forth is at.
Gotcha. And one last one, Mr. Chairman, and I think this one's going to go to Commissioner Cruz, but it might be to the Secretary as well. When we deal with these commutations, some of these inmates are going to have other charges that they're awaiting upon a release. So do we know how many people were commuted versus how many actually physically left the facility and have not re-entered another for a different charge?
No, I don't. I will get that back to you. So you want just the state inmates that have left, and did they answer to some other charge? Can you say that one more time?
Yes, ma'am. Basically what I'm looking for, it's, obviously some folks who are commuted are awaiting other charges for various reasons, and they might be commuted, but they don't actually leave a facility, or they are booked in another
I don't
facility.
believe that any of that happened.
So every single commutation that was issued, not one of those inmates remained in a facility.
Oh, yes. I'm sorry. I'm misunderstanding what you're saying.
I don't know what the legal term is you use. I'm sure some of you guys know that, but I'm trying to see how many people actually exited. It's one thing to say, hey, we commuted X number of sentences, right? It's a whole nother thing to say these are the number of people who actually left. And that's just what I'm looking for, is that difference.
Okay, I got you. I'll get that back to you.
It's my belief, is that Senator McDaniel?
Yes,
It's my belief that we did not include anybody that had other pending charges.
Okay.
So that really didn't arise in the context that you have framed it. But we will get you the actual count of the numbers that actually left the institution.
Very well. Thank you all very much. We appreciate it. Thank you, Mr. Chairman.
Commissioner Cruz, don't leave yet. Let me summarize. So the numbers, the 1,200 and some odd numbers, are actually prisoners who left, who were set free, as opposed to, okay, that's good. Commissioner Cruz, could you tell me how many, if any, of the folks whose sentences were commuted and set free have been recommitted to, have been rearrested for either the same or another charge?
No, I can't today, but I will get that information back to you.
I would appreciate that very much. Thank you.
If we have it.
If I have it, yeah.
It may be it may be that we don't know about that yet, depending upon when charges were placed and so forth. But if we can find someone, we'll let you know.
Okay, thank you. Senator Wise, I believe you had a question or two?
Thank you, Mr. Chairman. This is Commissioner Brewer. Commissioner, thank you for the work you're doing and across the state in these times and in any other times. Thank you for your service and your men and women in gray. My question is, at about mid-April, there were reports on social media that I just wanted to get some accuracy from, that there were snipers placed within the annex as a result of the governor's press conference that had taken place at that time. I didn't know if that was active intelligence that you all had received of a specific threat, or what the decision was, and if that was any truth to that, of what was reported and then what was actual factual with that. If you could give us some kind of background or some information on that, it'd be appreciated. Thanks, sir.
Sure. I believe you're referring to what is called KSP snipers, and we don't refer to those folks as snipers. But I think to answer your question, we have and continue to have people on what we call Overwatch, which is obviously at high locations, sometimes on top of the Capitol itself, sometimes in a high location at the Capitol Annex. There was a photograph or two that surfaced that showed some of our tactical folks carrying some gear, but we did not have any type of sniper, anything like that on top of the roof. That was fueled by social media. Obviously, from an Overwatch position, you get a very good look at the crowd to not only make sure that our troopers are protected, but to make sure that protesters are in a safe environment as well. So that's not unusual for us to do that, and we've done that in years past as well. But no, sir, that's not correct.
Thank you very much, Commissioner.
Yes, sir.
Commissioner Brewer, as long as you're there, with regard to the protests at the Capitol, I think you mentioned 6 or 7. Have any of those been violent in any way, shape, or form?
No, sir. We have. I'll have to credit our folks and to some degree some of the protesters, but we have not made any physical arrests at any of those protests. Now we have in Louisville. We've had several arrests throughout the days, but at the Capitol itself, we've not made any physical arrests. We do have one particular case that we continue to work on, where a counter protester possibly flattened some tires on the vehicle of a protester. We're working on that, but we haven't made an arrest in that yet, as I understand it. But no, sir, we haven't.
So there's no, other than the one you just mentioned about the potential counter protester, there's nobody else who's under investigation for violence or anything like that?
Well, I won't say we're not investigating some folks. There have been some arrests on some threats that were made to the governor. But as far as the protest itself, the physical protest, we have not had any enforcement action there.
Thank you. I believe you said that troopers went out to about 3 or 4 churches, if I recall your testimony correctly. Can you tell me in what counties the troopers visited?
Yes, sir, I can provide that to you. I don't have it in front of me today. As I mentioned, they were scattered over about, concentrated in about 3 of our western posts, E-Town, Bowling Green, and I can't recall the other one. And then we had 1 or 2 in our post areas in eastern Kentucky. But I can get you those specific locations.
I appreciate it. And one last question that I have for you right now is you mentioned 90 hospitals, I believe, had KSP presence in rural areas. Were the troopers actually needed, or was just the fact that they were there, you feel, help prevent any issues?
We did make some arrests, but in all honesty, I could not say that was related to COVID issues. Some of the arrests that we made were quite frankly, typical Friday night arrests of folks that had come in perhaps intoxicated, belligerent, whatever. That's not obviously entirely out of the norm. But luckily, I think the thinking was that the hospitals could possibly reach capacity, and that could cause some disruption in service and possibly some disruptive behavior. The governor, like everyone else, does not have a crystal ball, so they're using the best data that they have. And I'm actually happy to say we did not have any incidents because the hospitals did not reach their capacity. But that was the original thinking, and we probably provided that detail for about 30 or 32 days.
Thank you. Representative Nemes is an honored guest here today, and I believe he has a question or two. So Representative Nemes.
Thank you, Mr. Chairman. I appreciate that. I want to start with Commissioner Brewer. Commissioner, in this time of unrest, it's good to see good to have someone with such experience as yourself. I'm from Louisville. I think I'm the only one in this committee from Louisville. I'm not on the committee, but here today. And my city's burning. We have what many are saying, a vacuum of leadership. But more importantly, to my point, We have our officers, including the Kentucky State Police, Louisville Metro Police Department, a lot of suburban police departments in Louisville, or Jefferson County, and our National Guard are being harassed. They're being assaulted. They're having Molotov cocktails thrown at them. They're having bricks thrown at them. They're having water bottles filled with urine thrown at them. They're having the nastiest expletives and so forth thrown at them as well. And the men and women who work for the Kentucky State Police and the other police outfits are extremely professional, reserved, patient, and it is impressive. It's a very emotional time in my life and anyone from Louisville's lives. And I want to thank you, Commissioner Brewer, on behalf of Louisville. Thank you and all of the people of the Kentucky State Police in every county in Kentucky that have come to Louisville and have helped us. Their professionalism isn't just because the men and women that you oversee or that you manage as the commissioner are so high quality. It's also a testament to your leadership. And so from the bottom of my heart, Commissioner, I want to thank you for the work that you and your troopers have done all across the state, but especially in Louisville in these last few nights. I don't know if you have a comment on that before I move on to other persons.
Well, I can't tell you how much I appreciate that. And I'd love to take all the credit for it, but very little of it is mine. And I can tell you that you and the entire committee, and I don't say this in a disparaging way against the Louisville Metro Police Department. There's some fine men and women on that department. But I cannot tell you the number of times that the Kentucky State Police has been singled out and praised for our patience and our diligence and our professionalism in all aspects of involvement in Louisville. But it goes much deeper than that. We've had pockets of unrest, different areas of the state in northern Kentucky, in Ashland Post, in Mayfield, across the state. And time again, our men and women have stepped up and showed their true level of training and professionalism and commitment to keep the state safe. And I can tell you everything that you said is true as far as the things that we've had hurtled at us, from insults to Molotov cocktails. And our folks have maintained a presence there that is more than impressive. And it makes me very proud every night when I go down to the briefings and we go through the ground rules every night, what the engagement rules are. Just like a baseball game that we go out to the mound, and even though everybody knows the rules, we go over them, we reinforce that. And they're very cognizant. This is a very strained environment, but that we're going to be down there for the long haul until we maintain some calm and cooler heads prevail, and then the city can take it from there. But I greatly appreciate your comments, and I hope some of my folks are watching, because they really are the ones that deserve the accolades.
Thank you, Commissioner. And again, I couldn't tell you how deep I feel grateful, how deeply grateful I am to you and to your troopers. I know that if we had the leadership in LMPD that we have at KSP, we would not be facing a lot of these problems. And now that our recent chief has been terminated and we have an interim, and we're going to be looking for new leadership, I call on you. I ask our mayor and our governor, who I think has provided good leadership here as well, to get together and to have you and others like you, in particular you, get involved in hiring our next leader for LMPD, because we need an LMPD like we have at KSP. If I can move on to my question now, Mr. Chairman.
Please, and we're running a little short on time.
Okay, thank you, Mr. Commissioner, Mr. Chairman. This is a different question, and I bring this up, and it's related to COVID because this RFP was released earlier this year. It's about prison healthcare. It was a $750 million bid, and it was a 10-year bid. It was a 21-day RFP, and I want to thank Secretary Noble for pulling that RFP, which was stunningly put out during COVID. But what I want is some commitments. I want to thank the Secretary for her commitment to transparency with the legislature. I think that's extremely important. But because this RFP was put out during COVID with the 21-day turnaround, even though it was later pulled, I think there's significant mistrust coming from me, certainly, and from a lot of other people related to this massive contract. So I would like to get some commitments that before an RFP is required to be bid upon, receive bids, that we're going to allow site visits, because there are a number of companies that do this around the country. 10-year, $750 million contract. I want commitments that there's going to be site visits. I want commitments that there's going to be a pre-bid contract meeting. I want commitments that there will be meetings before the RFP is proposed with all or a number of these companies that do this throughout the country, because what that'll do is protect the taxpayer and make sure that the best bid possible is put out. And after the RFP is proposed, you can't meet with them. So we need to meet with them before so we can get the best possible RFP to bring the best bid for the Kentucky taxpayer. I also want to make sure that I would like a commitment that the RFP proposal, before it's put out, be brought to the General Assembly Budget on Subcommittee over Justice and Judiciary, because I don't trust the process right now. I trust you, Secretary Noble, and thank you for pulling it. But I want to make sure that it's the best bid possible, and we're going to have to fund it for 10 years after the contract is signed. So I want to make sure the General Assembly is involved in making sure that we have the right particular things that are in that RFP that go out before they go out. So I'd like you to get a commitment on those 4 things, and if we can't get them, I'd like to know why we can't commit to those 4 things, and I'll repeat them if you need them. Thank you.
Thank you, Representative Nemes. You know, I do have to say this. I was not the secretary. It was not this administration when that RFP was formed and when the background work was done on it. It was already submitted and in the works when I came in. And I want to thank you, Representative Nemes, because you brought some things to my attention that frankly I had not been aware of. I checked into them. I realized this was a totally unsupportable situation, and I did what was necessary to pull that RFP. This is the commitment I will give you. I am not actually knowledgeable enough, as I say here this minute, to say, yes, sir, I will totally agree to all 4 of the things that you've asked me, because you frankly surprised me. But I will give you this commitment. We will put out a proper RFP, and if those things are part of a proper RFP, they will be included. And I don't mind your oversight. I don't mind you looking into what we're doing, because I've never done anything that's improper that I'm aware of, or certainly not intentionally in my life, and I wouldn't do it now, not for this medical contract. I can tell you that we are looking into a different approach to the contract. This was what I will call, for lack of a better term, an omnibus bid, and it does last for 10 years. There are some points in favor of that. There are also some points against it, one of which that I know the legislature has consistently disliked, and that is the 10-year term. So the points that you make about the possible cost for this contract or its duration are valid, and I recognize them. Without thinking through and being on the spot, you're not likely to get a straight commitment out of me for those 4 items, but I will be glad to meet with you. And as this process goes forward, I will 100% commit to a good and open process for getting this RFP set up, Representative Nemes. And I don't think my answer is probably any surprise to you today.
No, it's not. Mr. Chairman, 2 seconds. You fought for transparency in the court, and I know you're going to fight for it in Justice Cabinet. A 10-year contract, even if it's a 5-year contract, 10 years, $750 million, the General Assembly is going to have to fund it. The General Assembly should be involved, not just in oversight after it's signed, because that's too late, in advance. So I'm going to be asked the Contract Review Committee to reject any contract that's not been pre-approved by the General Assembly for, and that massive. Thank you, Mr. Chairman.
Could I ask you, Representative Nemes, if there is currently, and I'm sincere in my question, if there is currently a process for that type of review while we are constructing, because if there is, I commit to follow it fully. But I just need to know what that process is, if there is one.
It's not in law. It's respect for separations of powers, and we will do our duty that we can do to make sure that our powers are respected, as just as you will. If this bid is put out, I don't care what's in it. If the legislature hasn't been a part of it, I'll work to reject the bid, because that's not in the best interest of the taxpayer. $750 million, 10-year contract is outrageous without the funders being involved.
I'll commit to this, Representative Nemes, so long as there is not an issue with separation of powers. I don't mind at all, and will be glad to take input from legislators on this.
Thank you, Madam
All right.
Secretary.
We're going to have to end this particular portion of our committee meeting. We probably have some more questions. And speaking of commitment, I will not commit to not asking you all to come and testify again. But I appreciate your willingness to testify. I appreciate your comments. And good luck to you all. And thank you very much.
Thank you, sir.
All right. Next on the agenda, from a different part of Frankfurt, maybe not. We have Commissioner Morris from the Department for Behavioral Health Development and Intellectual Disabilities. So I apologize, Commissioner. We got a little long-winded in our previous discussion. So sadly, we only have about 20 minutes with you. So you may find that that's good or bad. But would you please introduce yourself for the record and then proceed with your presentation?
Certainly. My name is Wendy Morris, and I am the Commissioner here at the Department for Behavioral Health, Developmental, and Intellectual Disabilities. And thank you, Mr. Chairman and committee for having us speak with you today. We did supply a PowerPoint. Did you all get those handouts?
Yes.
Okay, terrific. So just the first slide here is just a quick overview of our department in case some are not familiar. Our department is responsible for the administration of state and federally funded mental health, substance use disorder, and developmental and intellectual disability programs and services, and that's throughout the Commonwealth. Our mission is to provide leadership that helps to prevent disability, build resilience, and facilitate recovery in people whose lives are impacted, again, by mental illness, substance abuse, intellectual or developmental disability. The next slide is one I use in virtually every presentation I give, and that just shows you the footprint of our department. It's quite substantial. We do have a central office here in Frankfurt, where we employ about 200 people. We run a number of facilities. Some are owned and operated by the state. Others we operate under contract. But we have acute inpatient psychiatric facilities, a forensic facility in LaGrange. We have 2 nursing homes for people with behavioral health issues, a number of intermediate care facilities for people with intellectual and developmental disabilities. There are 3 specialty clinics associated with those ICFs. We have a specialized personal care home and a couple of residential substance use programs. On the outpatient side, we work with the community mental health centers. There are 14 community mental health centers, and they collectively serve all 120 counties. And both on the inpatient side and on the outpatient side, what we do is we really serve a population of people that other providers are either unwilling or unable to care for. And those are people with serious and persistent mental illness, people who may be a danger to themselves or others, people who may require extended stays in an institution, people who are homeless, and so on and so forth. And collectively, this system of care is our public behavioral health safety net. The next slide will show you our goals. We update our goals at the beginning of every calendar year and make those available to the legislators at the beginning of session. So hopefully this looks familiar to some of you. It was included in the annual report we disseminated in January. Central to our work there in the middle in red is to preserve and enhance that behavioral health safety net that I outlined on the map. We want to be sure that that people have access to meaningful trauma-informed services, and again, that's really for that those underserved and at-risk populations. To the side there in teal, another large goal is to continue working to develop and expand a recovery-oriented system of care for people with substance use disorders, and that's to address both the opioid crisis but other substance use disorders as well. In gold is our goal to support and promote the behavioral health wellness of children, especially those who are at risk or already involved with child welfare. In gray, assure a safe and adequate system of care for people with intellectual and developmental disabilities. And last but not least, in the lavender is to advance efficient and effective operations for our department's facilities. Again, these goals were all established pre-COVID, but they all continue to be pertinent in the work we're doing currently. The next slide, I'll just talk about some issues of concern during the pandemic, which I believe was your question for me today. First and foremost is assuring that we have that people have access to behavioral health treatment and recovery support during this crisis. So that's our main aim, is to protect the capacity that we currently have, but also to make sure that we meet the growing demand, and the demand is growing. The bottom line answer is yes, we have been able to assure services are available. Some services look different. Not every service is available, but we do have services available to anybody who needs them. We do know that the psychological impact of the pandemic, of social isolation, those are not insignificant. There's a lot of published research on it. And we know that the response to that psychological impact has been central to one of Kentucky's central responses. The governor lists prioritize mental health as one of his important 10 steps. I think he goes over those most every night. So on his 10 steps to fight COVID-19, prioritizing mental health is on there. And we also have a number of resources on the Kentucky COVID-19 website available to people. So we know that the impact of the pandemic is especially pronounced for people who have pre-existing behavioral health problems. So that would, again, include people with serious and persistent mental illness, children with severe emotional disability, people who have substance use disorders. But we know that there's also a lot of people who are having a new onset of symptoms. Especially, this could be especially hard for healthcare professionals. And, it's related to the new stressors, fear of contracting the illness or having a family member contract the illness, social from family, from friends, or support systems. We know a lot of people were stressed by trying to homeschool their children. We have folks who are unemployed and have financial concerns. Things can contribute to that. So crisis intervention has been another area that we want to stay focused on. We have seen a significant increase in the number of calls to our hotlines. The callers who we're hearing from express more acuity in those feelings, and we have more first-time callers than we have before. A couple of things that we are paying specific attention to is suicide attempts and deaths and overdoses. Are the data that we have right now, and there is a lag. There is a pretty significant suicide data. Right now, we don't have data that shows an increase in deaths since the emergency declaration was put in place, but we do know from other similar events across the globe that we should anticipate that. We should anticipate that there's going to be an uptick of suicide deaths or suicide attempts, and so we're trying to be sure that we get lots of information out, that we're making sure that we have paying attention to that, not just the data, but to be working on prevention. And so we've made a lot of efforts towards that. Overdoses, on the other hand, we have seen an uptick in overdoses since the end of March. Those we're able to monitor daily by the Kentucky Board of Emergency Medical Services, as well as hospital admissions. So we're able to get more timely data on that. The Lexington Herald actually reported last week that fatal overdoses in Lexington are up 42% from last year at this time. Louisville was up 11%, and more than 10 counties report similar trajectories. I think what's really important to know, though, is that these deaths of despair, as some call them, which are your deaths from suicide, from drug and alcohol overdose, have been on the rise for more than a decade. So this uptick is not something new. It was an existing epidemic, so we want to be very careful as we look at it in the context of this pandemic, not to draw conclusions too early. So this uptick may not be at all related to The virus, it may be an outlier, a blip, and maybe it's going to go back down. So it's much too early to draw conclusions. But I assure you, it's something we're paying a lot of attention to. The next slide is on our strategies. What are we doing? First and foremost is telehealth. That's been huge for our ability to continue to provide services. Virtually any service that was being provided face-to-face pre-COVID can now be provided by telehealth. We're using this extensively in the outpatient setting, especially in the outpatient setting, and folks can also provide services by telephone. In our community mental health centers, several of the clinics have set up a special room in their clinics. So if they have clients who don't have the technology, the equipment, or the service, and need to come to the room where they can be by themselves and be provided the appropriate equipment and visit with somebody socially distanced in another room. On the inpatient side, we're able to use the telehealth to make sure that our physicians are available, even if they're having to, if they need to be out because of their own illness. We haven't had that happen, but it could. And other critical professionals can still be available to the facilities. We've been able to do our evaluations for admission to our facilities by telehealth, and we've even had court hearings. We have frequent court hearings in our hospitals for continued stays, for forced medication, competency hearings, and we've been able to do those things using telehealth equipment. The other thing that's new because of COVID and not necessarily something our department is doing, but there are a lot of virtual forums that popped out for recovery support groups, things such as Alcoholics Anonymous and Narcotics Anonymous. I've heard from folks in the recovery community who say that they actually prefer some of these virtual forums because they're able to access them at a time that fits their schedule, and they're getting to interface with some new people, some new groups, and have found some good support. Harm reduction has been another big focus, making sure that we are getting lots of messaging out and training, distributing Narcan, those types of things. We were doing a lot of that pre-COVID, but we're doing even more of it now. Our department, my office, has frequent calls with our safety net providers. I'm having weekly calls with a group of community mental health center CEOs, and then another day each week I'm meeting with all of the facility directors. Pre-COVID, we met with those groups once a quarter. We're now meeting once a week, and we talk about what's working, what's not, what barriers are you facing that we need to help overcome. Medicaid joins us on every one of those calls to make sure we're talking about things like pre-authorization and issues that might have come up with MCOs and all of that. So everything's being dealt with just as efficiently, as quickly as we possibly can. And then we're also being very aggressive with seeking out additional grant funding. We were awarded a $2 million grant as part of the CARES Act to deal with mental health and substance use that came from SAMHSA, the Substance Abuse and Mental Health Services Administration, so some federal money. And then we recently applied for a suicide prevention grant and hope to hear about grant in the near future. The next slide, I just want to talk for a minute about building back better, because while the consensus seems to be that we might be hit again with the virus in the fall, we currently see things slowing down. And so we want to really pay attention to what have we been doing that's working, such as telehealth, that we need to, and what things maybe didn't work so well or we didn't get in place quickly enough. So again, we are really advocating for telemental health to continue, for there not to be an end to that. We've seen that mental health appointments, medication management, case management, all types of services are working very well by telehealth. It's been clients, it decreases their travel time, so we're not having as many missed appointments. They don't have to worry about childcare. So there's less expense. And it works better for the clinic when there aren't missed visits as well. We also will continue to have virtual meetings, advocate for continued virtual recovery forums, and most likely continue to have some of our conferences by virtual means. We've learned that for conferences to provide education to folks when they're done virtually, more people can come because they only have to step away from their job for a couple hours instead of having to travel and be away for a whole day. So that's been good. We're also looking into some new strategies, and these are things we have talked about before, but things that we continue to look at now in the context of this pandemic and potential future public health crises. And one of those is the certified community behavioral health centers. This is something that a number of other states have already put in place, and it's really to have a comprehensive healthcare, medical, and mental health kind of in one location for people with serious and persistent mental illness and children with serious emotional disorders. So the cabinet is really exploring this quite seriously. Our department is working closely with Medicaid for a potential prospective payment system and look at what would be the cost, the savings, and the potential improvement in outcomes. There's a lot of data out there to show that the states who've implemented have had really good outcomes. And then also looking at a new waiver program for people with serious mental illness. It would be similar to the SCL or supported community living waiver that we have for people with intellectual and developmental disabilities, with a focus on residential employment and case management supports and services. And then my last slide is just, again, without mental health, there is no health. So we always go into that. And that concludes my presentation, but I'm happy to take it.
Thank you, Commissioner. We'll have a couple questions. I believe you mentioned that there's no data or no information on suicides at this time because the data lags. Did I understand correctly?
Correct. We don't, well, the data we have doesn't show an uptick, but sometimes, the coroner's information and other things for things to be declared, for us to get vital statistics, we really don't get accurate data on any kind of real-time basis. But it is something that we're paying attention to locally and nationally.
Okay, you expect to have that maybe in a month or two?
No, I can get it to you when it does come. I don't have a timeline. I don't think we get data probably once, real good data, but annually. But we have some national data sources that we're keeping an eye on.
You mentioned an uptick in overdoses since the same time period from last year, and I understand that it may not be all COVID related. But if you've graphed these, does the increase, is it linear, or did all of a sudden it go up dramatically, exponentially?
I would have to look at it. I haven't seen it graphed. We have seen other bumps up like this before, though. To my understanding, it's not a spike that's bigger than other spikes we've seen if you look at it longitudinally. But it is concerning because we want to pay attention to, is it on and up, or was it a spike that's going to come back down, which we have seen a number of times.
Okay, if you could provide that to me, and we'll get it to all members of the committee, I would appreciate that. Did you or any members of your department have any input with the Justice Cabinet regarding what the felonies that would be commuted? And the reason I ask that question is you've specifically mentioned in your presentation opioid and drug overdose and that issue. And as I look through the presentation from the Justice Cabinet, there are people who were released for trafficking in other than marijuana. So it just seems to me that there should have been some consultation with you and I'm wondering, did that actually happen?
I don't know, I don't know offhand if there was consultation beforehand. Was not with me specifically, but I know that our team did work with them to make sure that the folks who were being released were gonna have access to treatment and access to Narcan. And so, to my understanding, everybody who got released, who had those kinds of issues was set up to have, they were gonna get an appointment for outpatient services in a Narcan. I can get the details of how that actually played out, what we planned versus what actually happened.
I would appreciate that. How about any other type of mental illness? I'm not a healthcare professional, but have you seen an increase in people who've been diagnosed with like bipolar or things of that nature that you think are attributable to the COVID-19?
No, we haven't seen that. But again, there's been a big increase to our crisis lines. People anxious or feeling hopeless, those types of things. More, symptoms of psychological distress than actual what I would call a diagnosable mental illness. But as people, that's something we'll pay attention to too. But we haven't seen an uptick in billable services. So, but we have seen an uptick to the crisis lines.
Okay, thank you. Representative Shmore, you had a question, and that will be the last question we have because our time has expired.
Thank you, Mr. Chairman. Commissioner, thank you for presentation. I was curious to if you think there's some patients out there being missed now with that you have to deliver your service.
Yeah, I think that's a valid question. That's something that we're paying attention to, certainly. When we had to close admissions to our hospital in Hopkinsville for a period of time, that facility historically had 6 admissions a day. And over the several weeks that we had it closed, we only had 42 people that had to be diverted for the area. And we asked ourselves a lot, were people, was it because people weren't accessing treatment? But we haven't, they're open and admissions are still down. We're trying our best to reach out to people. The population that we've been most concerned about is kids, and kids who were getting school-based services. So when the schools closed, there's a percentage of kids that the Department for Education has been unable to reach and that our clinics have been unable to reach. And so we haven't really seen these. As a matter of fact, we feel like we're doing pretty good with our pre-existing adult clients as far as reaching them with health, but it's the kids that we've been concerned about. And so we continue to interface on a regular basis with the Kentucky Department of Education. We're paying attention to what's going to happen with school in the fall and how we're going to make sure kids are getting the services they need.
Okay. Commissioner, thank you very much for your testimony. The committee and I certainly appreciate it. As I told Commissioner Noble, I won't commit to not asking you to come back and testify again as we go along, but I certainly appreciate
Absolutely.
your testimony, and thank you very much.
Thank you. You'll have a nice afternoon.
Thank you, too. Members, before we adjourn, a couple things. Want you to note that remote access will be allowed from the interim. You will be provided information prior to the meeting as to how to access the meeting remotely, and meeting materials will all be made available online. One final thing, if there are any members participating remotely who've not indicated their attendance, please let the secretary know. Yeah, we'll get to do that. Email would be fine. So the next item is adjournment. Before we do that, I want to thank everybody for attending, either remotely or in person. I really do appreciate it. I know these are tough times for everybody. And so may I have a motion for adjournment? I love the hammer.